Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Goldman-Fristoe test of articulation assesses an individual's ability to produce speech sounds correctly. It evaluates articulation skills by measuring consonant sound production across various positions in words. The test is used primarily to identify speech sound disorders, such as phonological disorders and articulation disorders. Its main purpose is to provide clinicians with standardized data to diagnose speech sound impairments and to guide intervention planning. The assessment includes eliciting spontaneous sound production and analyzing errors like substitutions, omissions, and distortions. This information assists in monitoring progress during speech therapy and determining treatment effectiveness. The Goldman-Fristoe test of articulation is indicated primarily for children aged 2 to 21 years who present with suspected speech sound disorders. It is most useful in clinical contexts requiring standardized assessment of articulation skills to identify speech sound errors, monitor progress, and guide intervention planning. The test effectively captures consonant production in spontaneous speech and isolated word contexts, aiding in the differential diagnosis of articulation versus phonological disorders. Its normative data supports comparison to age-based expectations, facilitating diagnosis and treatment decisions in pediatric speech-language pathology. The assessor begins by presenting the 25 test stimuli pictures, prompting the examinee to name each item spontaneously. Responses are recorded for articulation errors, including substitutions, omissions, distortions, and additions. The test is divided into two sections. The Sounds and Words subtest, with 25 items, assesses articulation in single-word contexts, and the Sounds in Sentences subtest requires the examinee to imitate repeat sentences containing target sounds. Responses are scored as correct or incorrect based on standardized criteria. Raw scores from the Sounds and Words subtest are converted to standardized scores using normative data stratified by age. Standard scores have a mean of 100 and a standard deviation of 15. Scores below 85 typically indicate articulation difficulties requiring further evaluation. Percentile ranks further contextualize performance relative to peers. For example, a percentile rank below the 10th percentile suggests significant deviation from the normative sample. Error patterns may also inform differential diagnosis and treatment planning. The sensitivity of the Goldman-Fristoe test of articulation has been reported to be approximately 0.95, indicating that it correctly identifies 95% of individuals with articulation disorders. Sensitivity measures the test's ability to detect true positives, meaning those who genuinely have the speech impairment. Specificity for the test is around 0.8, reflecting that 80% of individuals without articulation disorders are accurately identified as not having the condition. Specificity refers to the test's capacity to recognize true negatives, preventing misclassification of typical speech as disordered. In a clinical setting, high sensitivity ensures most children with articulation errors are flagged for intervention, while adequate specificity reduces unnecessary treatment for those without such errors. These metrics highlight the test's reliability in distinguishing between affected and unaffected individuals in speech assessment. The Goldman-Fristoe test of articulation was originally developed in the mid-20th century by Arthur Goldman and Edith Fristoe to provide a standardized measure of speech sound production in children. The test's validation process included administering it to a representative sample of children across various ages and dialects to establish normative data. Psychometric analyses conducted during its development demonstrated strong reliability coefficients, with test-retest reliability values exceeding 0.9 and inter-rater reliability consistently above 0.85, indicating high consistency of results across different administrations and examiners. Additionally, construct validity was supported through correlations with other established articulation assessments, confirming that the test effectively measures speech-sound production skills. Subsequent research by Goldman and colleagues, as well as independent investigators, has further substantiated the test's clinical utility and accuracy in identifying articulation disorders, reinforcing its standing as a robust tool in speech-language pathology practice. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.